Coronaviruses are a group of viruses from the Coronaviridae family that cause the respiratory illness. The name corona is derived from the crown-like spikes on the surface of these viruses. There are 4 subgroupings of the coronaviruses, namely alpha, beta, gamma, and delta. From the lab analysis, coronaviruses have been found to be enveloped by a positive strand RNA and the largest gerome among all these RNA viruses, which gives them a very high rate of recombination. Coronaviruses are zoonotic in nature. They are transmitted among animals and birds, and most notably between birds and humans. It is estimated that 70 to 80% of emerging and re-emerging infection diseases are of a zoonotic origin, that is, animals and human transmission. The transmission of coronaviruses is usually by droplet and contact. In some cases, these viruses have been found to be seasonal, with their littleness increasing in cold seasons. Coronavirus illnesses mostly affect the upper respiratory tract in children and the lower respiratory tract of immunocompromised individuals and the elderly. They might appear as mild as the common cold and as serious as pneumonia or bronchitis, and often exacerbate underlying respiratory diseases. Symptoms include a runny nose, headaches, cough, sore throat, fever, and body pains. However, there are several instances individuals are asymptomatic. Coronavirus is transmitted through droplets and airborne transmission. Droplet transmission. With droplet transmission, transmission occurs when one is in close contact within 1 meter with a person experiencing respiratory symptoms of COVID-19. Disease transmission occurs when infected respiratory droplets get into contact with the respiratory tract of an uninfected person through eyes, mouth, or nose. Droplet transmission is also possible through dirty surfaces. For example, if an infected person touches something, he or she leaves behind infected particles. If an uninfected person touches the same surfaces and touches their face, he or she might be infected. Airborne transmission. In airborne transmission of COVID-19, the coronavirus is carried within the nuclei of particles released from the body. These microscopic particles stay in the air longer than droplets and move more than 1 meter. The risk of airborne transmission of COVID-19 in clinical setting is limited to a few operations where aerosols are produced during treatment. These include endotracheal intubation, bronchoscopy, open suctioning, admission of nebulized treatment, manual ventilation before intubation, turning the patient to the prone position, disconnecting the patient from the ventilator, non-invasive positive pressure ventilation, tracheostomy, and cardiopulmonary resuscitation. There has been 3 outbreaks of highly infectious coronaviruses in the world so far. The severe acute respiratory syndrome coronavirus, SARS-CoV, the Middle Eastern Respiratory Syndrome coronavirus, MERS-CoV, and the novel coronavirus COVID-19. These diseases have been occurring through inextricably linked ecosystems and the impacts of the climate change, massive population growth, and leading to human-animal conflict. The spread has been aided by international travel. Emerging in early 2003 in China, the SARS coronavirus affected over 8,000 people in North and Southern America, Europe, and Asia and caused 774 deaths. It is believed to have come from birds and infected humans through civet cats and the spread through human-to-person contact. People infected with SARS first exhibited fever and chills before progressing to pneumonia-like symptoms. There have not been any known cases of SARS coronavirus since 2004. In 2012, the first case of MERS coronavirus was reported in Saudi Arabia. It is believed to have come from the dromedary camels. By October 2019, the MERS coronavirus, it had spread to dozens of countries in the Arabian Peninsula and the United States, causing 850 deaths from 2,400 lab-confirmed infections. The MERS coronavirus induces severe respiratory illness, including fever, cough, and shortness of breath. In December 2019, the novel coronavirus 2019 was identified from people in Wuhan city of China. All initial cases were linked to the Wuhan seafood market Infected people exhibited respiratory symptoms ranging from mild to severe symptoms. In subsequent months, cases are reported in cities all over the world. COVID-19 casualties. In Kenya, there have been 30,120 confirmed cases of COVID-19 since December 2019, with 474 patients dead so far. In just the last 14 days, there have been 8,486 new cases and 108 recorded deaths. Countries around the world with confirmed COVID-19 cases have been rolling out screening and contact tracing and sharing confirmation with WHO for a coordinated global response. The organization supports affected countries and provides guidance on effective ways to manage the outbreak. It has also been working with a global network of researchers and experts to deliver accurate and timely information to the world. It is also working on a possible cure or a vaccine to prevent any further spread. Kenya receives about 800,000 airline passengers from China per year. An additional 3.4 million people fly from countries around the world, including Italy, where COVID-19 has been particularly deadly. The first cases confirmed in the country were from the part with a history of air travel, but there have since been recording local cases with no record of international travel. Initially, screening travelers into the country was an effective way of keeping the COVID-19 at bay. At this point, however, contact tracing is the most effective strategy in stopping the spread of the disease. Of course, this is along with the provision of quality and timely care for existing cases, promoting infection prevention and control measures.